Men's prostatitis is because they don't have sex enough. Some people also say that women will not have dysmenorrhea if they have sex. Many old drivers don't know this. Let's talk about dysmenorrhea first. Many sisters understand the pain of dysmenorrhea. Those few days every month are just like going through a tribulation. At this time, do you often hear people say, it will be better after marriage, and sex is the most effective way to treat dysmenorrhea? In fact, this statement is not very reliable. Dysmenorrhea is divided into primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea is caused by no organic disease. The uterus of women of childbearing age will periodically thicken the endometrium under the action of estrogen, and prostaglandins will be produced in this process. When menstruation comes, a large amount of prostaglandins are released from the shed endometrial cells, causing uterine contractions. If the menstrual blood does not flow smoothly at this time, the lower abdomen will begin to hurt. This type of dysmenorrhea is very common in young girls, and it usually occurs some time after the first menstruation. Secondary dysmenorrhea is caused by gynecological diseases such as endometriosis, uterine fibroids, adenomyosis, etc. No matter what kind of dysmenorrhea, it has nothing to do with sex. Some people may ask, why do some women relieve dysmenorrhea after getting married and having children? This is because some women are born with an overly curved uterus or a tight cervix, which causes menstrual blood to flow out unsmoothly. After pregnancy, the uterus enlarges as the fetus grows, the cervical canal softens, and the fetus expands the narrow cervical canal during delivery, and then the menstrual blood flows out smoothly, and dysmenorrhea is gradually relieved. However, during sexual intercourse, it is difficult for the male genitals to reach the cervix, let alone expand the cervix, so the problem of dysmenorrhea caused by blood stasis cannot be solved. Moreover, for dysmenorrhea caused by endometriosis due to hormone changes in the body after pregnancy, the ectopic endometrium will shrink and disappear. The disease will heal itself and is not the credit of sex. Next, let's talk about the problem of prostatitis in men. There are many men with prostate problems now. Statistics show that more than 50 of men have been troubled by prostate problems at least once in their lives. Among men aged 20-35, 1/3 have been troubled by prostatitis. Some people say that this is caused by not having sex and regular sex will not cause it. This statement makes sense. There are two main ways for our body to discharge prostate fluid. One is to discharge it during ejaculation, during sex or masturbation, and the other is to discharge it through prostate massage by doctors. If there is no sex for a long time, prostate fluid will accumulate, and those inflammatory secretions cannot be discharged, which is easy to cause prostatitis. Regular sex can allow the prostate to metabolize normally, discharge prostate fluid in time, help to remove bacteria and inflammatory secretions, promote prostate function recovery, and inflammation subside. But there is a premise here, that is, it must be regular. If sex is too frequent, the prostate will be repeatedly congested and swollen, and it is also easy to induce prostatitis, so you have to grasp this degree. There are also details after sex, which many people ignore, which affects the health of both men and women. After sex, both men and women feel like urinating, but the timing of urination is different for men and women. If you are a girl, you must urinate in time. Because the female urethra is very close to the vagina undanus, these two places are full of bacteria, and vaginal secretions are also a cultured dish for bacteria. During sex, bacteria can easily retrograde into the urethra and cause urinary tract infection. Urinate immediately after sex, and the urine can flush away the bacteria, which plays a preventive role. In addition, girls can drink a glass of boiled water beforehand to increase urine volume and better flush bacteria. In daily life, girls should also drink more water, urinate frequently, don't sit for a long time, and hold urine. Do a good job of personal hygiene. Don't wear tight underwear and don't abuse detergent. Wipe your butt from front to back after going to the toilet. Exercise more to enhance resistance. It is best to wait 5-10 minutes before urinating. Because the male genitals have not completely softened after sex, the expanded corpus cavernosum will compress the urethra, and the male urethra is long and curved. At this time, if you are eager to urinate, the pressure in the urethra will increase, which will cause urine with bacteria and metabolic waste to flow back to the prostate, inducing prostatitis. So you have to wait until the penis is completely flaccid and the body is relaxed before urinating? My dears, these two questions about sex life and health are clear to everyone, right? You should pay more attention in the future. Maintain a healthy lifestyle and correct sexual concepts so that you can have a great body. Do you have similar health questions or experiences? You can talk to me in the comment area.